Lot at stake, of course, tomorrow, the big day for health care repeal and replace. I want to get reaction right now from one of the top Republicans in the Senate, Senator John Thune of South Dakota. Senator, the House Speaker saying again he is confident in telling her point blank they don't see a delay in this if they don't have the votes tomorrow. Do they have the votes to get this through the House tomorrow, sir?
That's the big question, Trish. In the House, if they're counting the votes, my guess is if they put it on the floor, they'll have the votes to pass it. But you know, it's a process, and it takes a while to get 216 or 218, whatever the current number is over there, votes necessary to pass this. And I think they're trying to put that coalition together. But it takes a lot of outreach, and as you heard Speaker Ryan say, the president's very engaged on this. So I think if they bring the bill up on the floor, I believe they'll pass it. I think they'll have the votes.
All right. Well, we heard from White House Press Secretary Sean Spicer just a few moments ago, repeatedly asked about where the votes stand. He wasn't willing to give a whip count to his credit, but at the same time, you know, it's not so much about the House at this point. It could be about the Senate. Right. They lose two votes. They lose two votes in the Senate, and there's nothing there. What are your colleagues in the Senate saying right now if they get this on their table? Will they accept this plan as is from House Speaker Ryan?
My guess is that when it gets to the Senate, we'll have an opportunity to work on it. And that's part of the legislative process. The House is acting. They're going to do make their contribution to this. They're going to send us something, and then the Senate's going to have its say. And we've got members who have concerns about various features of the House bill that they would like to see strengthened and improved upon. But the House has laid a great foundation. And when it comes to the Senate, we'll have an opportunity to build on that. But the one thing everybody agrees on is the status quo is completely unsustainable. I mean, you heard of Speaker Ryan describing markets are collapsing, premiums are skyrocketing, people have fewer choices. That's what Obamacare has left us, and that's an example of why central planning and big government don't work. We want to give the market a chance with competition, giving people choices, an opportunity to see their rates go down. The main issue, Trish, that people care about is costs, and we want to address costs and make health care coverage more affordable to more Americans.
All right, so, Senator, you know, with all due respect, I mean, I know that there's a lot of positive comments coming from the White House and, of course, from Capitol Hill on the GOP side, but at the same time, there's a lot of behind-the-scenes, maybe deal-making going on, in particular with President Trump. We just, a few moments ago, got a readout of the representatives that he called this morning to meet with him at the White House, and even Representative Yoho, at that meeting with President Trump, told our own Neil Cavuto on Fox Business that still a no. It's still a no. But if things are, you know, if we're so confident about this vote tomorrow, then why is President Trump hosting a slew of representatives this morning to get them to turn their votes to a yes, if it's so sure?
I think well, I don't think there's anything that's a given. I don't think there's anything that's absolutely certain at this point. That's why the efforts at outreach continue. But I think it's all about trying to build that coalition, and it's a legislative process. I mean, getting the necessary number of votes in the House and then later on in the Senate, you have to work with individual members, because you have in the House 240 Republicans and in the Senate 52 Republicans, all of whom come from different parts of the country, have different ideas about the best way to fix this. And in the end, we're going to need all their votes to make it happen. So it is a process that continues, but I think we're making good headway there. And if the House can get it across the finish line there, send it over to the Senate, we'll start that process in the Senate. And our members have, as you pointed out, you know, we've got senators who've expressed concerns. But I think at the end of the day, people realize if it's either the status quo or it's moving to an entirely new model that gives American people more choices and creates more competition and drives down costs. That's really what this exercise is all about. And we know what we've got today. Right. Flat doesn't work.
Senator John Thune, thank you so much for your time today, and a crucial vote for the American people and, of course, for our viewers as well.
Absolutely.
We're going to be watching. Senator, thank you very much.